So I'm Jim Del Rosso. I'm a dermatologist that's on the editorial board and one of the editors of the journal Skin. And I'm very happy to be talking about a recent publication in May 2023 by Danny Zachria and other colleagues. I was one of the individuals involved with this expert consensus panel looking at adherence to treatment for when they're managing actinic keratosis. And here we're primarily talking about different field therapies. We've had several different agents that have been available over the years that show efficacy. They're different in their modes of action and also potentially the amount of inflammation, duration of treatment, and downtime that patients may experience. And the outcomes, when you really look at adherence, what patients are looking for is something that they don't have to do for very long, something that's not going to create a lot of visible inflammation and irritation. So they necessarily have to be aware of maybe not going to work or going to social events because exposed areas tend to get more red and inflamed, and what the outcomes are in terms of both the short term and the long term clearance. So we've known over the years how important field therapy is to treat visible lesions and also subclinical lesions, but it's been slow for clinicians to adopt because of some of those barriers. Topical tirbanibulin, which is an agent that just has to be applied daily for 5 days, has very good efficacy data based on the standard parameters that are looked at. But because of its mechanism being more in terms of stimulating apoptosis and less in terms of inflammatory response, patients tend to have a shorter period of time that they're going to have some visible inflammation, and the visible changes appear to be less. So this has actually turned out, based on some good evidence, to be very highly favorable for patients, and it is a different mechanism of action. So to summarize, we have several topical options that can be utilized, but topical tirbanibulin only needs to be applied once a day for 5 days, which is very convenient and easy to use in a field therapy type of effect. It's associated with less visible inflammation, less redness, and for a shorter period of time than the other therapies. And so it's very important in that regard. Patients are likely going to use it, and it's something that's convenient and has very good efficacy based on the available data. In fact, in the American Academy Dermatology Guidelines, it's reported to have a very high level of evidence in terms of its scientific data. So it's something to definitely consider.